If you're not familiar with the autonomic nervous system, please pay attention to what I'm going to tell you. If you're like most people, the autonomic nervous system, let's call it the ANS, is the center of problems you deal with every day. The ANS is made up of the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system, found in the spinal cord, is responsible for keeping you alive in the short term. In other words, if you are in mortal danger, then your sympathetic nervous system jumps into action to protect you. This is also known as fight, flight, or freeze. The sympathetic nervous system, like the parasympathetic nervous system, is in charge of functions that occur automatically. In other words, you don't have to think about them. We can call it the automatic nervous system if we'd like. This includes things like controlling our heart rate and the strength of our heartbeat, so we can pump blood around in a hurry to get out of danger. For its part, the parasympathetic nervous system is found in the vagus nerve, and that is responsible for rest, digest, and repair. The parasympathetic nervous system is activated when we are obviously relaxing, sleeping, digesting, and trying to repair damaged tissues, which takes place largely during sleep. It's also important for optimal immune function. These two systems are in constant interplay and a little tug-of-war. As we go about our day-to-day lives, neither one should be dominant. They should be in what we call a state of balance. But when we are in fact in danger, or when we need to focus in order to, say, solve a problem, or take a test, or perform an important procedure, or when we see flashing blue and red lights behind us as we're driving along. When that happens, the parasympathetic nervous system gets turned off because digestion and immune function and repair aren't that important. If we are not going to be alive 10 minutes from now, then our body doesn't care about those long-term functions. Once we get past the emergency, then the autonomic nervous system can go back to a state of balance where neither system is dominating. Now, one of the big problems we deal with in modern society is that we do not live in a state of balance. Most of us are actually in a state of sympathetic activation or sympathetic dominance. This means that we are often on edge. We're in fight or flight mode a lot of the time. Why is this an issue? Simple. Because when the parasympathetic nervous system is shut off, guess what doesn't happen? We don't heal. So, one of the first things we do when a new patient comes to the office is work on rebalancing the autonomic nervous system. Of course, there are things you can do on your own at home, but if you don't want to take forever to start your healing journey, then there's a procedure that we perform in the office. Very simple, it takes 5 minutes. It's called neural therapy that helps rebalance the autonomic nervous system so that everything else that we do together is more effective in accomplishing your healing journey.